Hello and welcome. My name is Nancy Berry. I am the Marketing Manager for Rosewood Centers for Eating Disorders and your host for the Rosewood Institute's webinar series, A Model for Conceptualizing the Treatment of Trauma, Developmental Immaturity, and Eating Disorders and/or Addictions. Joining me in the studio today is Stephanie Scoville. Stephanie has been working full-time in the counseling field since 2006. Her clinical experience includes a specialization in crisis response, trauma, and eating disorders. She has specialized in the treatment of eating disorders for almost 2 years after 4 years of full-time trauma specialization, including a particular interest in dissociation and attachment theory. Stephanie was trained in EMDR in 2007, seeing success in using the protocol on a regular basis with clients. As the lead clinician for the Rosewood Institute Outpatient Adult Program, she is skilled in facilitating multiple styles of group therapy, including experiential groups, psychoeducational groups, DBT, process, and support groups. Stephanie has also provided community trainings to a variety of professional audiences throughout her career, with topics ranging from crisis response, domestic violence, sexual assault response, eating disorders education and prevention, body image, and trauma. Stephanie looks forward to sharing her experience and passion with other professionals, providing compassionate care to the Phoenix community. Welcome, Stephanie.
Thank you, Nancy. And thank you to all of you who are listening today. I hope that it's not shifting. I hope that by the time our time is finished today, you will be able to do some of these things. To identify, maybe in a different way than you've ever thought about it, the relationship between trauma and codependency and addictive behavior. And today when I reference addictive behavior, I'm really also referencing eating disorders. We approach eating disorders from an addictions model here. And so the information that you're hearing and learning today is really applicable to all kinds of addictions, which include eating disorders. Also, codependency is going to be referred to today as developmental immaturity. And so when you see those words, that's the understanding that we have of what codependency actually means. I hope that you'll also be able to identify 3 key factors on how trauma and unmet needs might influence addictive behaviors and eating disorders, and describe 6 or more recovery tools needed that can help your clients achieve emotional and behavioral balance and find freedom from their eating disorders and other addictions. To start, I'm going to use this metaphor of a tree. I find it to be an incredibly useful metaphor, not just from a clinical understanding, but it's also a helpful one to share with clients. It's a very clear understanding to them, and I've seen their eyes light up when they realize that their out-of-control feelings and experiences actually make sense in this context. And how it goes is essentially that at the roots of the tree, as you see, are trauma. And trauma can include unmet needs, attachment disruptions, neglect, deprivation, and obviously overt forms of abuse. It's a very broad thing. And that's one of the things that's really helpful in helping clients to understand is that a lot of them come into treatment and they assume that trauma means sexual abuse, for example, or domestic violence, or something really drastic. And those things are, of course, trauma. But the definition of trauma is so much broader than that. And helping them to understand that is a huge part of the beginning of their process. When trauma goes unresolved, it leads to the trunk of the tree, which here says CODA, which is short for codependency. And we're going to get a little bit more in detail today about what exactly that means. But to the left of the trunk of the tree, you see core issues: self-esteem, boundaries, reality, dependency, and containment. And those are the different core areas that codependency affects. And we're going to talk in detail today about what that means, what each of those categories means, and how that manifests in someone's life. So trauma begets codependency, and then codependency, moving up the branches of the tree, leads into these different examples of addictive behavior. So you'll see on your slide that what's listed is alcohol, money, shopping, relationships, sex, food, drugs, gambling. And what I tell my clients is really anything can be in those branches, and the only parameter is that it has to feel out of control in their life. So these are all the reasons that people seek treatment in the first place. And so eating disorders are included in this. Various forms of addictions are included in this. And very often what happens is they start to spin out of control. It's the proverbial rock bottom that we all are probably familiar with our clients reaching. And that's often when they will reach out for help. And so when they first come to us, we see all of these behaviors in their life, or whichever ones are fit that particular client. In the case of my work at Rosewood, the primary ones that I tend to see are obviously issues with food, eating disorder on all sorts of spectrums, as well as drugs and alcohol are an extremely common comorbid issue for many of our clients. And so this addictions model works really well in treating both of those things. So this is a helpful metaphor for understanding a client's behavior and presentation right out of the gate. And a lot of times what happens is the very early stages of treatment and recovery are focused on what's going on in those branches. Without stabilization of some of those behaviors, it makes it extremely difficult to get into the trunk and the roots. And that's what we are going to talk about today. So as we get started on this, I wanted to share with you what definitions we use, and I teach my clients, with trauma. It's anything less than nurturing or experienced as shaming. So as I mentioned earlier, that can include physical and emotional deprivation, neglect, abandonment, unmet needs, and attachment injuries. And when I first share these types of definitions with someone who has always just assumed that they didn't have that bad of a life and they don't understand why they have an eating disorder or an addiction, their eyes get really wide because they realize in hearing that really what trauma is anything less than nurturing or experienced as shaming. What that means is a lot of their life has been traumatic. And it really opens the door to a better understanding of their own symptomology. Codependency, for the purposes of what we're doing today, is the inability to esteem oneself based on the concept of inherent worth. Which leads us into discussion of, according to PMLity, the first ego state, the precious child. What happens when codependency occurs and someone is unable to esteem themselves based on that concept of inherent worth? It tells me that this precious child ego state has a disruption or an injury. So what PMLity teaches is that at birth, the inherent nature of all children is valuable, vulnerable, imperfect, dependent, and spontaneous and open. And as life happens, trauma, family of origin things, all kinds of stuff, those aspects that make us precious, that we are inherently precious because of, they tend to get distorted and damaged. And we begin to change our behavior based on our trauma, based on our experience in our family of origin. And that connection with our inherent worth as the precious child begins to go away. And in this model that we're going to talk about today, the developmental immaturity model, which if you remember, developmental immaturity is sort of code for codependency. What happens is it starts with childhood trauma and dysfunctional childhoods. Now, dysfunction can mean many things. No family is perfectly functional. So everyone has a bit of dysfunction going on. But that leads to developmental immaturity. When you add childhood trauma and developmental immaturity together, that leads to unmanageability in life. And so referencing the tree metaphor, the unmanageability aspects are what's going on in the branches of that tree for each client. Those are the things that feel unmanageable. They've gotten control of their, taking control of their life, and they feel unable to stop on their own, hence unmanageable. All three together create relational problems. And why that's important is because relational problems are the most common reason people seek treatment. So many people come in because of intimacy issues, because someone was concerned about them, because they realized, nothing else has been worth seeking treatment until their relationships start to be affected negatively, and they realize that they're going to be alone if they don't make a change. So this is significant in terms of motivation. This is an overview of the entire developmental immaturity or codependency model. You'll see that across the top are the different categories: nature of the child, core issues, secondary symptoms, and relational problems. And so what we're going to go through with this is essentially the different core issues that were next to the trunk of the tree in that first tree slide. And so to begin, I'm going to go through each one separately. You'll notice that on the very left-hand column, these are all of the precious child descriptors. Number one is valuable. We are born into this world valuable. When childhood trauma happens, that affects our maturity in that area. And we develop some version of immaturity that creates self-esteem issues. If you move to the next column. Self-esteem issues tend to manifest in a way where people feel either less than or better than those around them. And that can show up in a variety of different situations. For example, a person who professionally feels very confident might tend to feel better than their colleagues, but when they're in a family situation or a social situation where they have anxiety, they might feel less than, instead of the same as. And so either of those extremes is an example of developmental immaturity. We're going to get into more details about how that really looks in a few slides. When self-esteem issues have happened because of childhood trauma, that drives unmanageability in terms of control issues. So control issues start to show up. That's our secondary symptom of the self-esteem issues. So we become either out of control or highly controlling of others. And again, different scenarios can bring that out in different ways, just depending on what's going on that day. But the symptoms of unmanageability in terms of our sense of control in the world come straight from those self-esteem issues that really come from our sense of value being damaged because of trauma. And what that leads to ultimately is relational esteem issues, not feeling okay in relationships. The second one is vulnerable. We're born into this world vulnerable. We need protection. We're not able to do things for ourselves yet. We're not able to even ask for what we need. We're reliant completely on caregivers to meet our needs. And what that leads to when childhood trauma happens, and remember, trauma is anything less than nurturing or experienced as shaming. And so families, that's helpful for parents to understand that a lot of this is not intentional. Most parents, I would say, of my clients never intended to harm them. And that's a really freeing concept for some parents because they'll tend to go into some shame about what they've done to create a child with an eating disorder or an addiction. But what happens when that vulnerability becomes damaged through trauma is that core issue of boundary issues, where we either tend to have no boundaries or be too vulnerable or very rigid boundaries, they're invulnerable. So our walls are up, and it protects us, and it keeps us in and others out. That, in turn, creates secondary symptoms of resentment, possible raging, emotional unbalance, all in response to our perception of our boundaries being violated and our belief in our worth to have boundaries. And ultimately, that all leads to the spectrum between either feeling enmeshed in many of our relationships or avoidant. So we either feel overly connected and like we can't express boundaries because we're enmeshed, or we avoid relationships altogether because we don't know how to appropriately set boundaries, and so it's just safer to stay away. The third category is that we're born into this world imperfect. And that's our reality. That's why the word reality is in parentheses there. What happens with addictions and eating disorders is the idea that we are imperfect becomes intolerable. And so what we end up doing is behaving and believing as if we are bad and rebellious or good and perfect. So here's where perfectionism comes in. We've all seen those clients that just can't seem to tolerate the idea that they could make a mistake. And that is where this comes from. It's from their reality becoming distorted about who they are and what it's okay to be, the type of person it's okay to be. And so from that bad, rebellious, or good and perfect place, those secondary symptoms of spirituality issues come in. When I first learned this, I found it really interesting that spirituality is connected with that sense of being perfectly imperfect, to use one of our common affirmations. It really is, though, if you think about it. You know, it is a definition, it is a way to define ourselves and to understand ourselves in the greater context of the universe. And when those spirituality issues and difficulties begin, then it creates dishonesty. This is dishonesty with self, about who I am. People lie to themselves about, because they can't tolerate, again, the most common example is they can't tolerate not being perfect. Or those people that overly identify with being sort of a bad girl or boy and can't tolerate anyone viewing them any differently than that, the proverbial scapegoat. And so that dishonesty is internal and it is also external. They are dishonest with others as well. And of course, that's a huge part of addictions treatment, is when people can finally get fully honest about what's going on, not only behaviorally, but also emotionally. And when they're able to do that, they're coming back to that precious child state of acceptance of imperfection. The fourth category here of the precious child is dependency. We have needs and wants that we cannot meet when we are born into this world. And we are trained how to get our needs and wants met by our primary caregivers from birth. What that teaches us when childhood trauma happens and or dysfunctional family systems is that it's not okay to have wants and needs. That would be the anti-dependent category. Needless, wantless, we call it a lot around here. And it's really helpful to challenge clients when you see that pattern developing, because many of them aren't even aware of it. They aren't aware that they're unable to accept that they have needs. And when they start thinking about it, it really gets into some deep-seated beliefs, and change can happen. The other side of that is obviously someone who's too dependent. So either they learn that they always need help and can't do anything on their own, and so therefore they must always have someone to help them, or they don't need anyone and no one is trustworthy, and they've got to do it all on their own, and it's not okay to need anything from anyone. And that's those dependency issues, which drive secondary symptoms of all of the behaviors in the tree that we've seen. Those addiction issues, depression, physical illness, you name it. Anything that someone spirals out of control with in their life can be listed there under secondary symptoms. And what that ultimately leads to is problems with interdependence. Not being able to ask for help when I need it, and or not being able to be skillful and competent when I do have the ability to take care of something in my life, always thinking I have to ask for help and that I can't do things on my own. And that creates real problems with interdependence. And finally, the last one is spontaneous and open. We're born into this world spontaneous and open. We don't know to be different. That is how we learn. We have to be open to our environment and to the care of our caregivers, or else we can't survive. But what happens is trauma occurs, and this leads to moderation and containment issues later in our life. And that can show up both behaviorally and emotionally. For example, we've got clients in our IOP, some of whom you can see this come to life in a group context, where when they get triggered in a group, let's say we're doing something really emotional, and they get triggered by that emotion, they spin so rapidly out of control that they have to leave the room, and they're standing outside the room sobbing hysterically because whatever just got triggered was so intolerable to them. So that's an example of emotional lack of containment. They have a really hard time not being completely flooded and overwhelmed by these emotions. The other side of that are those clients and those people who tend to over-control their emotions. And they shut them down before they even have a chance to recognize that they're there. And I've seen both extremes probably in equal amount in working with eating disorders. It really is just dependent on the person and their environment and how they learn to deal with their own emotions. This obviously also comes out behaviorally with things like addictions. Eating disorder is a classic example of a lack of moderation. It is either, like in the case of, let's say, binge eating, totally out of control, or in the case of an anorexic, they're classically known as very controlling, and that is true. Their behaviors are so rigidly controlled, and that is what drives the disorder. So what this lack of moderation and containment can lead to in the secondary symptoms category is intimacy issues, an inability to know and be known. And that is true for knowing themselves and knowing others and letting others know them. It's not safe to do that. They have to either be acting in their out of control, and that's all people can know about them, or so controlled that no one knows anything. This leads to intensity issues ultimately in relationships. And the intensity, again, can be on either side. And either way, it damages relationships. If you're always out of control with your emotions and throwing them on everyone around you, that damages relationships. If you never show emotion and you're completely locked up, no one can feel close to you. And so this is an ultimately big picture understanding of how trauma creates these different core issues that are all part of what codependency is, or developmental immaturity, and how that negatively impacts the lives of our clients. So we've gone big picture, and now we're going to break it down a little bit more. There are, as you see, 6 schematics that make up the human experience. Okay? These are all independent of one another, and all together they form our identity. We have a physical part of ourself, mental, emotional, spiritual, social, and sexual. And we are not complete without all of these aspects of our world, of our experience, being acknowledged and connected to. Let's start with physical. What we need at the very basic level is food, shelter, and warmth. We could call that safety and having our basic needs met. Perception. This is part of our physical need, the need for perception. And the 5 senses, being connected to those things. With our mental self, we need growth. We need to have our reality validated. And what this does is it begets respect, or creates respect. And that is self-respect, as well as respect for others. And this is our mind. Emotionally, we need love, respect, and acceptance. Sounds pretty basic. I think we would all agree that that sounds really nice. This helps to create an acceptance of our feelings when those things happen. Spiritually, we need freedom of choice. We need connection to some sort of higher power to feel like we're a part of something greater. And that is our spirit. That allows us to connect to and accept our spirit. I thought it was really interesting that freedom of choice is a part of this spirituality one, because once I had those words to put on it, I started realizing how many of my clients never felt like they had choice in their life. Whether that's because of an overbearing parent or family expectations or whatever. So many of them feel like they don't have choice in their life. And then when they have an addiction, they still don't have choice. And that is the ultimate illusion, is they all say, my eating disorder gives me control. It's the number one thing I hear. But in reality, it's controlling them. And so it really disconnects them from their sense of spirit. Socially, that interaction with the world, belonging, fun, that is one of our absolute most basic needs. We are not meant to be alone. Human beings are born into clan for a reason. And one of the things that happens consistently with my clients can sit in a room in group and have 20 people there, and every single one of them will say that they feel alone, lonely, and they don't know how to fix it. Yet here we are with 20 people, all of whom feel the same way. And what I really have learned is that the eating disorder and addictions completely isolate people for all kinds of reasons. But it makes them believe that they're not even worthy of belonging somewhere, or that they're not capable of it. There's nowhere that they can belong and feel good about themselves. So when someone is raised without that sense of belonging, without that fun and spontaneity, it really affects their ability to interact effectively with the world. And finally, we have sexual. The sexual self is the one that everyone's always the most uncomfortable talking about, and everyone giggles. But the need for relationships and interdependence is a part of that. It's not just about the physical act of sexuality, of course. Really, this is referencing intimacy. This is part of the sexual self. And down at the bottom there, I've written that down because I think it's just really important. The greater the gap between what we needed and what we got, the greater the dysfunction, and likely the worse the addiction. So if you have a client who did not get what they needed in any of these areas growing up, they did not have their basic needs met, they did not have their reality validated, they did not feel loved or accepted in their family, and so on and so forth, their developmental immaturity is going to be more intensive than a client who says, well, I know that I was loved and accepted. I always got to choose, who maybe 5 out of 6 felt like their family did a pretty good job. Their dysfunction, their intensity of their addiction is going to be less so than someone who didn't get anything they needed at all. And that just makes sense. But all of these together, when those needs do get met. So part of this process is reparenting and teaching people how to recognize when the needs are not met in these different areas and how to do that. When they begin to be able to meet those needs for themselves, it creates a sense of acceptance and connection with themselves that was not there before. So this breaks the 6 schematics down into, this is only 4 of them because only 4 would fit on the slide, but the point of this slide is that the addiction separates those things out. Clients feel really disconnected in all of these different areas. Now, some of them might feel more connected in some areas than others, but it's important to help them identify where do they feel disconnected and unaccepting. For a person with an eating disorder, their number one thing when they first walk in the door is they feel totally disconnected from their bodies. They do not accept their bodies. And that does not matter. That is across the board no matter what the eating disorder. Body image issues are rampant. And this is a direct result of feeling disconnected, first and foremost, from their own body, because when they're disconnected, it means they're not accepting. They're not accepting something about it. And the same is true for feelings. Feelings is the secondary thing that I see. First it's body, then it's feelings. They have learned and are in such a habit of remaining ultimately unconnected to their feelings because it's too scary. There's too much going on that they don't know how to handle, and so they shut it down, or they overindulge it. Either way, it's not acceptance. And the ultimate goal is to be able to work with each of these areas. So I'll often set treatment goals based around this model and have them assess where do they feel like their level of connection is in these different areas. The other thing that this really affects is when clients become stabilized enough and are able to maybe start their trauma work, what you'll see if someone is still active in some kind of eating disorder or addictive cycle, it will block their ability to fully resolve and come to some acceptance around these different areas of their life. And so it's really important to be able to help them see how exciting, really, and important it would be to set some goals in these different areas. Spiritual goals, emotional goals, goals for their body. And when they're in eating disorder treatment, those goals are often follow my meal plan. But as they get further in recovery, they can get more creative with those things and what that can look like. The goal of therapy is to reintegrate all of these things to the authentic self. So this is supposed to be a person, but it looks like a star. And it's just a representation of a human being in our self and our identity and our experience. Starting with the body is on the outside, of course, because that's our physical shell. And it just demonstrates that this is really, and I'll show this to clients, this is really what we hope will happen ultimately in their treatment process, that they will feel reintegrated and feel like their whole self. Some of them it will be again, and some of them it will be for the first time in their life. It really just depends on where they're coming from. I have some clients who can clearly identify times past when they felt good and whole and complete, and others can't do that at all. And so for some of them it might be helping them to even understand that that's a possibility, because if they don't know and they're not aware that that can even be, then they're not going to know to set it as a goal. The real caveat here is that they must stop their behaviors in order to do this. Addictions block the ability to reintegrate and feel like a whole self. So we find ourselves sometimes clinically in a catch-22 of knowing when to push on the trauma and when to sort of send them deeper into it in order to resolve, versus when they need more stabilization so that they can stop more behaviors in order to be able to do this more effectively. It's not always clear-cut, and that's when your clinical judgment really comes in. So we started off with talking about the precious child ego state, and that's the first ego state. The second ego state, if you look at the upper left-hand corner, is the wounded inner child. This makes sense. You know, you think about what it's like to be a kid emotionally, and things are a little out of control sometimes. We don't have the capacity of understanding how to deal with scary feelings. And so as a result, you know, the terrible twos is named that for a reason. We throw tantrums, and who knows? All of us are a little different, but kids are known for their emotional nature. And what happens with these ego states is that when childhood trauma occurs, there is an emotional part of a person that gets sort of stuck in that wounded inner child feeling, that scary feeling that we've all experienced when something's overwhelming and we don't know how to handle how we're feeling, and we don't feel good about ourselves. So that's essentially what the wounded inner child is. When someone is in that state, they feel very less than those around them. They put other people on a pedestal and assume that they are the problem, that they are wrong, that they are bad, that there's something wrong with them, and other people have it right. They feel too vulnerable, so those boundary systems are not intact. They feel bad and rebellious, and you might see that behaviorally. They might act out, yell. I've had clients yell in group. We even had one guy punch the wall. He had to repair it. But those are examples of wounded inner child behavior. Overly dependent and out of control. So looking down the page a little bit, the emotional energy of this ego state is 8 to 10 on a scale of 1 to 10. So this is the most intense emotional energy ego state. The emotional age that most people feel when they're in this state is 1 to 6. Just as an anecdote, I tend to hear 4 or 7. Those are the two that for some reason tend to stick out for people, 4 or 7. The overall message in that ego state is I am bad. It's a very shame-based way of being, way of thinking. And that's really pertinent to understand. This is a shame-based ego state. They remain, some part of them remains wounded based in shame. So because that ego state is so emotionally intense, that 8 to 10, many of us can't tolerate it for very long. And so, following the arrow, we swing, kind of like a pendulum, over to the adapted defended adolescent, which is the third ego state. And so, think about what it was like to be a teenager. I know that I felt like I was always right, and that nothing bad would ever happen to me, and that everyone else was, wrong, and mostly that people were stupid. That's how I felt when I was a teenager. And so that's what it's like for a client who is in this state. You'll see that type of attitude. It's not as emotional. The emotional energy is 4 to 7, so it's still kind of high, but it's more in the mid-range. It's manageable, and that's exactly why we do this, because the wounded inner child is so intense that it's so painful we can't stay there. And so in order to protect ourselves from the feelings that are in that wounded inner child, we swing to the adapted adolescent. We feel better than those around us, looking down our nose. I am awesome. You are not. We feel invulnerable, which means that our walls have gone up. Our boundaries are so rigid in this state that nothing's getting through. I'm right. You're wrong. Too bad for you. This is where perfectionism kicks in. And people being perfectionists helps them to stay in this ego state rather than going back to the wounded inner child. So that perfectionism serves a very strong emotional purpose because it allows them to continue to feel better than people. And that is much more tolerable than feeling less than and terrible. We go needless, wantless when we're in our adapted adolescent. We stop needing because what we've done is we've disconnected from the fact that we actually have needs. And we don't want to feel that because it's too painful. And so we just pretend we don't have any needs. I don't need anything. I am good. I am good and perfect. We get very controlling of others and really of ourselves when we're in this phase. And the overall message is you are bad. Okay, we're pointing the fingers at others when we're in this place. The emotional age there is anywhere from 7 to 18. A couple little tidbits here is we still use this with our adolescent program. They learn this model just like our adults do. And how our therapist who runs that program handles it is she just teaches them to be able to identify when they're getting into these types of behaviors and ways of thinking that are not good for them, knowing that adolescents are going to naturally kind of be here sometimes. And so it's normalized, but it's also the difference between being a normal teenager and when you're getting into that better than attitude is really illuminated for them so that they can identify for themselves when it's becoming unhealthy for them and when they need to watch it. Also, one of the things that we notice is that as people progress through treatment, very often they'll come in, and not always, but often, they'll come in that wounded place. And they'll be really emotional, and they'll cry all the time, and they'll just have a lot of feelings, and they feel terrible, and they feel ashamed, and this, that, and the other. And then eventually they start to shift, and they come in, and more often maybe they're in that other place of adaptive adolescent. And we actually see that as a sign of progress, because what it means is that they're emotionally moving through milestones that they need to move through in order to reach the fourth ego state, functional adulthood. So let's talk about what that is. This one has the lowest emotional energy, 1 to 3. Emotional age, 18 to 85. So any age. It's just whatever age you are, you feel your age. And that functional adult self, what I teach everyone is that they all have it. Even our adolescents learn. They've got a functional adolescent that they can access. And they are capable of feeling this way. Same as those around them. Capable of having healthy boundaries, taking responsibility for their reality, accepting their own imperfections, being able to express their wants and needs in a healthy way, and being able to balance spontaneity with moderation so that you can be spontaneous and you can also be moderate. You don't have to get out of control with it. And so that's really when, referencing back to the 6 schematics, when a person is able to connect to and accept those different aspects of their experience and their identity, the physical self, the emotional self, and so on and so forth, you'll know that reintegration has happened when they start feeling more like a functional adult more often than not. You'll start seeing these swings between wounded inner child and adaptive adolescent lessen over time. They won't stay in their shame, in their wounded inner child quite as long. They'll be able to catch themselves in the swing and be more functional with emotions or with triggers or with their eating disorder and what's going on. And it's really a beautiful thing when you start to see that happen, because you know that something good is happening. And now it's time to talk about some specific tools that you can use clinically, and even our dietitians use this as well. We train our dietary staff on working from this model so that they can know how to talk with clients in a way that helps them to move through some of those intense feelings, because very often dietary sessions is a place, especially in early recovery, where their wounded inner child or their adaptive adolescent comes out very strongly, because dietitians are the proverbial bad guys. Not really, but that's how a lot of clients feel. And so the first tool to help people deal with their wounded inner child is to teach them how to give themselves permission to feel and learn to tolerate extreme emotional energy. This is a lot easier said than done, because the ability to let themselves feel is one of the scariest things for a lot of our clients, either because they've been traumatized by their own emotions because of the intensity of them, or because they have spent so much time and effort staying disconnected from those emotions because they're too scary. And so emotion tolerance, using things like DBT, emotion regulation skills, and distress tolerance skills, CBT, REBT, all those different approaches to dealing with thoughts and emotions are a way to help them learn how to do that. And honestly, one of the most effective things that I've seen is people just remembering to tell themselves it's okay to feel. That's a really powerful affirmation. The next thing is to identify negative messages. Like we saw with the different ego states, the wounded child has the I am bad message inherent in it. I am worthless is a big one. And so whenever you hear clients talking that way, or saying that they feel worthless or they feel unlovable, or any of those common negative core beliefs, that's what's happening, is their wounded child is talking. And when they're in that, you have to remember that it's super intense. They feel really, really sunk in it. And so they're going to need to learn how to identify those messages, and that they're coming from the wounded child in them, and that it's not true of them. That's just how their wounded child is feeling. The next one is to resolve trauma issues and do grief work. And of course, there's so many different ways of doing trauma issues. There's psychodrama, EMDR, somatic experiencing, empty chair and Gestalt type works, exposure. Whatever your specialty is, whatever you're trained in, the ability to help a client move through trauma is going to be really crucial to their long-term success. Because without getting at that core of trauma, the roots of the tree, they're just going to relapse. And so what will happen is, at a certain point in recovery, clients will say, they'll start to feel better, and they'll be like, I don't need to come anymore. And I'm like, oh no, this is where the work begins. And so it's really, really crucial so that they have less of a chance of relapse, that they get at all those core beliefs and the trauma and the grief that has happened. And the other piece about grief is that a lot of times for people with addictions, when they start letting go of those addictions, they go through a tremendous grief process just to not have that in their life anymore. And so grieving the loss of their eating disorder, the loss of their addiction, is a big part of the work as well. And finally, teaching them how to nurture themselves. Now, when someone is deep in their wounded child, this feels impossible, because the ability to nurture oneself means that you have to access some kind of self-love. And when someone is in their wounded child, they don't feel self-love at all. They feel the opposite of self-love. And so a lot of them look at me like I'm crazy when I tell them to take care of themselves, because they don't know, they literally don't know how to do that, or how to even conceptualize what nurturing of the self could mean for their life. And, you know, love is the antithesis to shame. And since the wounded child is a shame-bound way of being, way of thinking, that's why it feels so impossible. And so this is going to take some time. But self-care, self-love, self-nurturing, in whatever way feels good, is important. And a lot of my clients will, you know, try to get away with things like, well, I'm going to go watch a funny TV show to take care of myself tonight. And that's all well and good. But in the end, does that really fill you up? And that's the question I'll ask them. And they slowly learn to identify what would be life-giving for them. And that's really what it is. The self-nurturing is about finding things that create passion and joy and excitement and positivity in their life and towards themselves. And so these latter two, 3 and 4, are definitely a little bit longer-term goals. The first two you can do immediately. And as you work through those 4 things, you'll notice their ability to sustain functionality will remain a little bit longer and a little bit longer. Recovery tools for the adapted defended adolescent are a little bit different. The first one is a lot of psychoeducation around defense mechanisms and distortions, cognitive distortions. So I've listed a couple of them there, like intellectualizing, you know, trying to put an intellectual spin on everything or analyze everything to death, and that's an avoidance of the emotion of the situation. Black and white thinking, catastrophizing, and there's many more. There's many more, and you can educate yourself if you're unfamiliar with all the different types of cognitive distortions. The defense mechanisms is a huge deal for the adapted adolescent because it is in and of itself a defense mechanism. We create that ego state in order to defend us against the pain of our wounded child. And so the ability for people to recognize their defense mechanisms and when they're getting kicked up and how to stop doing that and learn to tolerate the real emotion that's underneath that defense is a really important part of it. And again, kind of similar, you can help people learn to do that by educating them with things like DBT and CBT. The second part is to help them to recognize their triggers. What just triggered? What happened just before I started feeling better than and went into that defended mode? What am I being reminded of in my woundedness? And really, another way of understanding it is, what am I protecting myself from? And that's a really important awareness for clients to gain in order to heal. Because if they never identify what they're protecting themselves from, then they're just going to be dealing with the symptomology. The third thing is to be able to learn to parent the self without criticism, neglect, or indulgence. Reparenting is a really important part of this entire treatment process. And so teaching people how to recognize their own inner critic and how much of a role that plays in the swing between wounded inner child and adaptive adolescent and the inability to stay in that functional is really key. So reparenting and challenging the criticism is going to be huge. What this box represents is our boundary system. And part of how to do what I just talked about is going to include helping people to identify what their boundaries are to begin with, and what areas they're either too rigid or not rigid enough. This can include external physical boundaries for some of our clients. Example of that would be if someone has difficulty saying no when they're put into, let's say, sexual situations. That's a classic example of an external physical boundary issue. Internal emotional boundaries look more like inability to defend themselves when people are talking about them. An abusive parent who calls their child names, that's going to create a boundary system that is not fully intact. And so as an adult, that child might grow up and feel unable to defend herself against someone who reminds her of her dad, just as a classic example. So how we teach people to what we call shore up the boundaries is really through a lot of call them affirmations, validations, statements that they can connect to that helps them to remember what their healthy boundaries are. So identifying who I am not is a huge part of that down at the bottom. Identifying those wounded and adapted messages and where those are coming from and why they're not true of who they are. I am stupid, you are stupid. I am wrong, you are wrong. I am bad, you are bad. Those extremes. Instead, we have to help them identify who they are. This is how we create boundaries. And so I won't read through all of them, but these are some examples of some positive statements that some of our clients have found really helpful. And there's one of them that's bolded that I want to talk about. My feelings will not kill me, but ignoring them will. That's something that I've seen to be hugely impactful for people. Either way, whether they ignore them or overindulge them, this statement has a moderation in it that really helps people understand what the result of their emotions can be. And so these are just some examples. And doing this, helping people to create these statements that are relevant to their own life, builds boundaries. So this next slide is some ideas on how to help people reduce emotional energy. When someone comes into our office in full-blown crisis and they are crying and they are inconsolable, what do I do? Okay. First step is give them permission to feel. And that can even come from you. People have really responded well simply to being validated that how they're feeling is understandable. Let them know that there are no wrong feelings and that feelings are human. And then ultimately they're going to be able to do that for themselves. But at the very beginning, they might need you to remind them of this over and over and over again. Sooner or later it'll sink in and they'll be able to do this. And so this is the first step when someone comes in, let's say at a 10 or an 8. Next is building tolerance. Building tolerance to those emotions. So guide them in what it's like to just sit with it and allow that emotion to pass through the body. I tell people that most emotions only hang around for about 2 minutes unless we do something to keep it around longer. And again, they look at me like I'm crazy, but really emotions are just emotions, and we can tolerate them, and we won't always feel this way. Grounding skills is a part of that. They're going to need reminded of this because when they're really, really intense, when they're at a 10 or an 8, that ability to think is really compromised. Logic kind of goes out the window. I mean, we all have experienced that when we just fly into some kind of emotion and we're not thinking straight. That's how they feel when they're in this place, and that's usually the wounded child. And so recognizing and having compassion for that your help in bringing them down is going to be the first step, and then they'll be able to do it for themselves. Again, identifying the message. So once you've gone through the first two, help them identify what just happened. What message were you responding to? Were you thinking that you were bad? Were you thinking that someone else was bad? Why'd you get so worked up? What just happened? And being able to identify that helps reduce that energy as well. Affirming and reframing to functional esteem. So this is kind of the boundaries thing that we just talked about. Affirmations. Choosing what you want to believe about yourself is the first part of this. And so when someone's wounded child has gotten triggered, what that means is that they need more boundaries internally and emotionally around themselves that tells them who they really are and not who their wounded child tells them that they are and their shame tells them that they are. And so being able to even have them list out and carry with them everywhere until it's ingrained in their mind. Who am I really? What do I want to believe about myself? Nurturing the self and shoring up the boundaries. That's how you affirm and reframe to functional esteem. Meaning, help them find their functional adult in the midst of some intense emotion. If they're able to do that, they're probably around a 3. And the last piece is to convert to the gift of the emotion. Many of our clients think the emotions are just bad. Bad, 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 bad. They don't like them. They don't like feeling them. These are some questions that they can ask themselves that will help them to convert what they just experienced to a gift. What can I learn from this? How can I connect? How can I be powerful? What are my values? And reminding them that that all emotions have a gift. Anger gives us strength and energy. Fear gives us protection. It gives us wisdom. Pain can bring healing and growth and awareness. Shame gives us humility, and it connects us with our humanity. And guilt reminds us of our values and helps us to make amends when we need to. It helps us to have containment of our behaviors. Helping people to connect to the gift of the emotion is the last part of reducing emotional energy. And if someone is in the space where they're able to do this, their emotional energy is going to be drastically reduced. Finally, we have functional adult skills. So what does the functional adult look like? How will I know if my client has reached the ability to live in this way, which would signal that they've reintegrated and formed their authentic self? Number one is that they're able to esteem themselves in the presence of their humanity. And what that means is I can connect with my own worth even when I make mistakes, when I am not superhuman, when I am just human. They're able to be intimate with moderate vulnerability. So they're able to let people know them, and they're able to know others with appropriate boundaries, making themselves vulnerable in the context of an appropriate relationship to do that, not running into the store and telling the store clerk all the trauma that just happened in your life. That would not be moderate vulnerability. Being comfortable with the self and accountable for your impact on others. So, feeling okay in your own skin. No more cheating on my partner and feeling justified because he was mean yesterday. That's not what a functional adult does. A functional adult takes accountability and feels comfortable in their own skin. Responsible for your own issues of self-care and willing to be interdependent. So in other words, they take care of themselves. They don't just rely on everyone else to take care of everything for them and to make them feel good about themselves. They're willing to be available for relationships. They're willing to be available for intimacy, to be relied on and to ask for help, to let people know them. And they're able to contain the self as well as maintaining a sense of spontaneity. So in other words, they're moderate, but they still enjoy spontaneous moments. And They're not locked up and unable to be spontaneous, and they're not totally overindulgent. But there's a nice balance in life of those two things. And finally, the functional adult is able to parent the inner child through affirmation, nurturing, and limit setting. This is sort of the ultimate hope, is that our clients can learn how to do this. This is what we all needed and some did not get. It's the absence of those three things that create developmental immaturity and all of those secondary symptoms that we see when people come into our office. And that's all I have for today.
Okay, thank you, Stephanie. We appreciate your time today. Unfortunately, we don't have time for questions, so I'm going to move forward to the screen where you can email us your questions, and we'll make sure Stephanie gets all of your questions and is able to answer them for you. You see that address in the middle of the screen, tri@rosewoodranch.com. If you send your questions there, we will forward those to Stephanie, and she will respond to each question that we receive. I also want to tell you now how you can get your continuing education certificate. Immediately following this webinar, you will receive an email with an evaluation and post-test attached. Complete both forms and return to the address on the screen. Upon successful completion, a score of 80% or better, and receipt of the post-test and evaluation, a CE certificate will be emailed to you. Send your questions or slide requests to tri@rosewoodranch.com. And to view this again at another time or any of our other webinars, please go to www.rosewoodinstitute.org. Thank you and have a good day.